Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today's show, we have Lyle Berkowitz. He's a physician executive. His Kevin MD article is titled, What Consumers Want from Telehealth. Lyle, welcome to the show.
Thanks, Kevin. Glad to be here.
So we'll get into your article in a little bit. First off, briefly share your story and journey to where you are today.
You bet. So I studied engineering, became a doctor, added on physician executive, and then became an entrepreneur, evolved into innovation over the years. But a lot of my career was spent at Northwestern medicine, internal medicine, primary care, practicing part-time, physician executive part-time, about a decade in the classic informatics IT, rolling out EMRs like Cerner, then Epic, another 10 years setting up one of the earlier innovation programs. Along the way, involved with a lot of digital health companies, got my street MBA, left Northwestern 5 years ago, joined MDLIVE, one of the big telehealth companies, number 2 executive there, learned a lot. And in 2020, left there, focused on HealthFinch, a company I'd started in the workflow automation space, sold that and retired for a second, and then did some consulting. Telehealth became big with COVID and wound up starting my new company, KeyCare, which does all virtual care on Epic, and here we are.
Now, a lot of physicians are interested in that entrepreneurial space, that health technology space, or health startup space. Now, how can they do that? What kind of advice do you have for them?
Yeah, I get this a lot. Yeah, hey, how can I do that? Start small, be a fractional chief medical officer, an advisor to a startup company, keep your day job, have some fun, learn, explore, and see if it's something you want to expand on, and then keep your mind open. One of my favorite quotes is Louis Pasteur. It's like chance favors a prepared mind. I've been shocked how many times just something sort of came my way, and the question is whether you're willing to take a little chance and take it. And I was lucky to have, a supportive family, great wife, who let me try some extra things on top of my day job.
Now, you talk about that quote, right? Chance favors the prepared, or fortune favors the prepared mind, right? So a lot of doctors, we don't have a lot of training when it comes to the business aspects, entrepreneurial aspects. So how can we best, quote unquote, prepare our minds? Do we need to get MBA degrees? What kind of education do physicians have if they want to enter that space?
I was fortunate to have in the business side some great mentors who taught me. I got like I said, my street MBA. I learned on the job. I had some folks who would help teach me, and by doing it part-time, it was easier. And I read a lot of books. I read a lot of management books, and that helped inform me, all the books about making companies great, etc. But with that said, a lot of folks are getting these MBAs to help them move into that job. And I never wound up doing it. I don't think you have to do it. I would say that the more experience you can get on the street, the better. That can also include in your organization, right? Volunteering for committees and other things within your healthcare organization. It's another great way to learn, because in the end, a lot of business is about politics and being able to work with lots of different people. As a doctor, a lot of times, we're used to being the smartest person in the room and everyone listening to us. The business world, it's got to be more collaborative. So the more experience you get and the more you like that, the better.
What kind of questions can physicians ask themselves to see whether they're suited to that entrepreneurial business world?
One is economics. Is this financially something that is going to make sense? And 2 is how well and how important it is you to work with a big team and to understand that you have a job and in a part that's part of a bigger organization, and it's not like in the exam room where you just get to be the authority. You have to really be collaborative. And of course, I think most of us think about, am I going to make a bigger impact? Because it's really important to doctors to make an impact. And most reasons that they go into a bigger business is because I think I can make a bigger impact that will affect more people. I do stress. I think it's important to really get a good baseline as a doctor to be able to have that impact. And that means at least 5 or 10 years of having some clinical experience before moving over. And again, continue to stress, there's a lot of value we can add part-time. And I think it's fun. We get to be doctors part-time, businessmen part-time. I spent most of my career doing both of those. And even though I'm 100% essentially business executive now, I still feel very much like after 20 plus years of practicing, I can bring in and have clinical experience that's still useful.
All right. Let's talk about your Kevin MD article titled What Consumers Want from Telehealth. Now, how did this article come together?
I kept reading these other articles and pundits who were saying, oh, telehealth is over. The surge has gone down. While we had 80% use of telehealth, during the height of COVID, now it's down to 10 or 15%. It's going away. I said, no, no, no. This is crazy. I know that patients must want telehealth. The issue is that physicians, I believe, are just getting used to going back to the office. And so the demand is there, supply isn't. So we commissioned a survey of patients and we asked them two basic things. One is, what would you prefer for your routine issues, not complex stuff, but routine, whether it's urgent care, chronic care, et cetera. What do you prefer? Office-based visit versus virtual visit? And over 40% preferred a telehealth virtual visit. A little under 40% preferred an office visit. That's great. About 20% preferred whichever one was first available. And I think it's important for health systems and doctors to understand that this is not just a maybe, but a preference by physician, by patients, and that if doctors aren't willing to be able to provide that in some form or fashion, someone else will. And the second question we asked and we talked about in the article was about how important it is that there's some continuity of care between these virtual care providers who might be taking care of you and your provider. And again, 79% said very important that they share the same record, which is essentially what we're doing with our new company by keeping everyone on Epic, because that data sharing allows for, we believe, higher quality of care and a more seamless experience.
So we're speaking at the beginning of February. What's the current landscape when it comes to virtual options for care?
So what we're seeing is a lot of health systems, a lot of providers are offering virtual care as an option, about somewhere in that 10 to 20% of the time. Depends on the specialty. Behavioral health is still maybe 80+% of the time. Internal medicine, maybe closer, 15, 20%, specialists, a little less. And most of those are scheduled visits. There's also a need and increase or demand for on-demand urgent care visits just because our ERs are full, urgent cares are full, or simply patients don't want to go there. They'll say there are a lot of sick people in those places. I might be a little sick, but I don't want to go to a place where other people are even more sick. And so there's a huge recognition by providers who recognize telehealth can work, and by patients who are like, this was really easy. This makes sense. I do this in every other aspect of my life. I want to do it more in healthcare. During COVID, it was clearly it could work. And so I think we're seeing that if health systems are trying to figure out how they can provide these services and or partner with others who can help them provide it, or recognize that they may be losing it and they're starting to get scared that the Amazons and others of the world are out there trying to take those patients at the front of the digital door.
So you said that about 40% of patients prefer a virtual visit for routine issues, but only 10 to 15% of internal medicine practices offer those. So what's the bottleneck? Tell me some of the obstacles that's contributing to that gap.
I think it's simply supply. That doctors are optimized for the office in many large health systems and groups. I call them officeologists, Kevin. Just like we had hospitalists rise in the 90s, I think there's a distinction between virtualists who are doing lightweight, routine type of care online, and officeologists who are focused on what's going on in the office. I think those should be more complex patients, but I tell you, our fellow doctors, we're optimized for the office. When we have our own office, right? It's nice. Everything's prepared for us. Our assistants take care of everything. Everything is prepped. We've been doing it for years. We're used to it. We know we're going to get paid a certain way for it. And so for doctors, there's not a big reason for them, if they're in the office and have an office, to do a lot of virtual care. Whereas a whole new crowd of virtualists are rising up who are much more amenable and optimized to be virtualists, working from their home, focusing on lightweight issues. And I think we have to recognize there's a distinction. For doctors to jump back and forth between doing office and virtual care is a discontinuous experience for them, and one that often doesn't pay as well additionally.
So you mentioned about the payment piece, right? During the pandemic, there were a lot of insurers and Medicare that paid for virtual visits, but that's going away as the pandemic progressed. So talk about the current landscape when it comes to payment for virtual visits. Are they mostly reimbursed?
Yeah, so these days, I think video visits in general are reimbursed at parity. The recent omnibus bill extended CMS payment for video and virtual visits for the next 2 years, even though the emergency order is coming to an end in May. We still have an extension. I do think Congress is going to eventually more likely formalize some level of reimbursement. Virtual care is here. It's not going away. I think most insurance companies recognize it makes sense. The question will it be paid at parity? You've got video, phone, asynchronous visit. From a fee-for-service perspective, I think there's still a lot of payment options, but I think we're also seeing value-based care, capitated models, et cetera, make a lot of sense for virtual care. It's also where you can bring in asynchronous models and automation to really help manage a population in a much more efficient and cost-effective way.
Now, you mentioned technology companies like Amazon going into primary care and virtual care. So what's the status there? Tell us more about that.
Well, everyone who can seems to be going into it, right? We're seeing the major companies, we're seeing Amazon, we're seeing independent third parties offering these lightweight, easy types of care, particularly for mild urgent care issues. And for patients, it's an easy option, but the problem is, they recognize at some point it's discontinuous from their base primary care physician, health system, et cetera. And the result is that the decisions, the quality might not be as great because they don't have all the information. And if anything serious happens, that information may be lost. But with that said, consumers are looking for easy options here. And my big advice to health systems is, if you're not going to offer those easy options, someone else will, and someone will disrupt you. And so that, to me, is a big message to be heard. Health systems have an opportunity right now to compete with these third parties. If they don't, they're going to get some of their lunch eaten.
We're talking to Lyle Berkowitz. He's a physician executive. His Kevin MD article is titled, What Consumers Want from Telehealth. So Lyle, look into your proverbial crystal ball. What do you anticipate the future of telehealth be, say, in the next 6 to 12 months?
6 to 12 months, I think we're just going to see continued increase in utilization. A lot of it is, though, going to depend on financial incentives. So the question is, who's paying for it? Insurers, employers, health systems, et cetera. I think we're going to see places that really figure out how to maximize this. A lot of the country is still going to be watching, but what we're going to see over the next 6 to 12 months is hopefully more and more places really becoming expert at it, and they will set the trend. It's sort of like the 4-minute mile. Kevin, once it's been broken, then others will go. And right now, I think we're looking to see who's going to break that 4-minute mile and really, as a health system in particular, figure out how to optimize and provide the best level of virtual care so that they can shift more of the routine care online. So the health system then can focus on more complex patients, and as a whole, they can manage a larger population, because if they can increase panel size by using a virtual care workforce, we start to solve a lot of these issues that we have. It's not going to happen overnight, but I think we'll see some, oases in the desert happening over the next year.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
To the doctors out there, be able to combine your passions outside of healthcare with your knowledge in healthcare. And again, volunteer and do whatever you can fractionally to sort of help and do some of these interesting business activities you might be looking at exploring, and see where that goes. And to the health systems and large groups, remember, if you don't disrupt yourselves, someone else will.
Wow. Thank you so much for sharing your time and insight. Thanks again for being on the show.
Thanks, Kevin.